Hi everyone, welcome back to the channel. Today I'm very honored to have Dr. Becca Kennedy, who is a family medicine physician specializing in treating chronic symptoms and long COVID using a mind-body approach. So thanks so much for being on the channel.
Yeah, thanks for having me. My pleasure.
Yeah, and I was really excited about this interview. I know we were just talking about it a second ago. Just in terms of talking about long COVID and how we can treat it using a mind-body approach that's kind of very focused on like the brain and nervous system. And I know you've treated a lot of people with long COVID from the sounds of it, hey?
Yeah, right. Okay. Hmm.
Yeah. And so I know there's controversy going back and forth. I've heard a lot online just about long COVID. Is it more a mind-body issue? Is it not? And so I guess to start, like, what symptoms are you typically seeing when you're treating someone with long COVID?
Yeah, I see lots and lots of different symptoms. And I was the lead of the long COVID specialty clinic at Kaiser Permanente Northwest, so I assessed hundreds of patients with COVID and worked with many, many patients and a huge gamut, a lot of chronic fatigue, certainly pain, dizziness, shortness of breath, chest pain are some of the big ones, but also those sort of zaps, kind of around the body, tingling, numbness, um, brain fog is a big one.
Yeah.
So I'd say that's kind of a lot of what I see, although really it can be kind of any symptom at all, rashes, lots of different things.
Yeah. Yeah, and that's the confusing and hard part about long COVID is that it's just such a vast amount of symptoms that really are possible. Like it can really be
Mm,
experienced very differently, almost person to person. Hey,
yeah, right.
yeah,
Exactly.
yeah. And I know for myself, and we're going to get into this, but I've treated a number of people with long COVID as well.
Hmm.
More a mind body approach and had some good results in terms
Yeah,
of that.
that's
But
awesome.
when we talk about like the history of patients with long COVID symptoms, like what do you typically see when you're treating someone? Because I know you've assessed, hundreds of people around this. What's the common factors that you see in terms of life history?
Well, from this perspective and the mind body approach, it's again really looking at the nervous system. And the nervous system, the way I describe it to patients often is it sort of gets stuck in the on mode. And so our lifetime threat adds to that. And the pandemic was hugely, hugely traumatic
Hmm.
and very, very stressful. And so you take that and then you add the lifetime threat that someone has had, and that adds to the brain becoming hypervigilant and stuck in the on mode. So most of my patients have a history of trauma, and that trauma can be capital T trauma or little t trauma. And sometimes it's childhood trauma, and again, capital T or little t. And sometimes it's not. Sometimes there's other traumas or stressors in adulthood, even for various reasons. Um, but it's really looking at all of those pieces and how that ties in with the trauma that we all went through in the pandemic. And some of the patients have had really severe COVID infections, like back at the beginning in 2020 when it was really scary, they couldn't breathe, their oxygen levels went low. But then there's other patients that their actual COVID infection actually was pretty mild and wasn't even really that bad. Um, and again, I think it really speaks to that it's how the brain is responding to this infection coupled with the stressors and then the ongoing response of the nervous system.
Yeah. Yeah, and there's so much in what you just said right there. And like I'd be fascinated on I'm not sure if studies have been done in terms of like long COVID and trauma, but we know with like several different types of chronic pain, chronic fatigue, chronic dizziness, like trauma, even if it wasn't at the onset, at some point in a person's past really increases your likeliness of developing chronic pain and symptoms. Do you
Mhm.
know at this point, like, have any studies been done on that in terms of like the link between trauma and like long COVID symptoms? Are we
There
still?
have been no, I have seen a few small studies that have showed the correlation or the connection between someone with a history of trauma, stressors, anxiety, depression, that is a risk factor for developing long COVID. Um,
Yeah.
yeah.
Okay. So there has been some studies, which makes sense. And I always think about, I remember talking about it at the time. The pandemic, it was almost this perfect storm that took place,
Oh my
unfortunately.
gosh. It was a perfect storm, and I mean, there's almost nothing more stressful than what happened with the pandemic is that there's a virus that's lurking someplace we don't know where it is. It could be one droplet, it could be on our groceries. We could either be fine or we could die. We could be young and healthy and we could still die. And we can't access medical system. It's all full up and we can't even go there unless we're on death's door, and we can't connect with other human beings, which is the thing that brings us the more safety than anything else. It,
Mhm.
it really was the perfect storm.
Yeah, there's so many factors at play, and I think that's important to know, right? Because with mind body concerns developing, it's not typically, it can be, but it's not typically like one event that brought that on for a person. Like there's so many
Yeah,
factors that
right,
are
right.
involved,
Yeah,
and the
right.
pandemic just hit like all of them, unfortunately.
Yeah.
Like there was just so much
Hmm.
fear about what this is. And then
Yeah.
like as people started to experience long COVID, like I remember watching the news back then, and it was just like every channel, every news article was just talking about how long COVID
Yeah.
is possible, and they're not sure why this is taking place.
Right, right. Yeah. Right. And so a lot of fear around it out there, and you don't know who it's going to strike, and there's no solution. And then presumably you could have it for the rest of your life. And really it is really infiltrated in so many places in our life, thinking about it, hearing about it.
Yeah.
Absolutely.
Yeah, and I had this moment I remember because I have young kids, so we had just waves of COVID in our house at this.
Yeah.
Like I mean, like probably 4 or 5 times within the course of a year, just
Oh,
back.
geez. Yeah.
Um, and I was very fortunate because my symptoms, like when I actually had the virus, were very minimal. But I
Yeah.
remember, and I gave this lots of thought at the time. I remember when I first got COVID, and I knew like my partner, my wife had it, but I wasn't feeling anything. I was fine. And then all of a sudden the COVID test tested positive, and I just got this like wave of symptoms like instantly. And so it's just this, it was so obvious to me in the work that I do. I was like, whoa, like there is just so much fear around the fact that I have COVID.
Yeah.
Symptoms went from
Yeah.
0 to 5 in the course of 30 seconds.
Yeah.
Yeah.
Right, right. Yeah. Yeah, it's funny. In a similar way, I really was not afraid of long COVID. I mean, COVID or long COVID, but of the acute COVID infection, really much at all. My kids are healthy and we're healthy. I really didn't have fear about it. And in my work as a family medicine doctor, I was actually the one that was seeing COVID patients, acute COVID patients in person, actually more than other people in our clinic, just for various reasons. I really wasn't afraid at all. And then my son got COVID, and his symptoms weren't that bad. It was like a mild cold, and we had him in our basement. And I would open up the door and sort of put a tray of food there for him. And he was having a grand old time playing video games with his friends. He was
Yeah.
having a blast. And every time I opened the door, my heart sank a little bit while I waited for his response. And my brain was saying, is he alive still? And that was even me that really didn't have fear around COVID in my family, but there's just so many messages and so much fear about it out there that, that gets in there, that gets into our unconscious brain. Even if we might not rationally think, that it's something that we need to fear, there's just so many fear messages all around us.
Definitely. And that kind of leads me into thinking, what you see in terms of like the reaction for people or your patients, like when you bring up the idea of like long COVID being a mind body issue? Because I know with other symptoms, of course, we know there's resistance. Like that's part of the treatment is working through that. But
Yeah.
with long COVID, like what are the reactions you typically see when you present this idea?
So much better than I thought they were going to be. Like I was a little nervous, frankly, to bring this up a lot, and most of the people are receive it really well. And because the thing is, I think it's really about how we explain it and how we understand it. Because mind-body syndrome does not mean that it's all in our head or we're making it up at all.
Mhm.
It just is really understanding the normal function of the brain connection with the body and our nervous system as a human being. And
Yeah.
if you can understand that and explain it well enough, then actually many patients say to me, wow, that's the first thing that actually makes sense to me that a doctor has said. And the other thing is that I think a lot of patients feel it. Like they intuitively know, or they describe it as like, they're like, this is neurologic, or this is I know it's coming from my brain, but I can't control it. I don't know what to do about it. They often experience it's worse with stress, better if they're relaxed. It kind of comes and goes. So all of these things that make sense that it's a, quote unquote, sort of stress nervous system problem, but really understanding the science below that is key. And there's lots of actually research and studies going on that actually looks at the biochemical changes happening in our body when our nervous system is stuck in the on mode
Yeah.
of hypervigilance and stress, and there's cytokine changes and mitochondrial changes, and the ATP inside and outside the cells, and inflammation. I mean, there's chemical changes happening in our body that are creating the symptoms. And I think that's really the piece that we need to convey is there's real changes happening in our body to create the symptoms. It's just that the generator of those signals and those symptoms is because of the fear in our unconscious brain, not because of damage in our body. And once you understand that, I think the pieces kind of really come into play.
Yeah. And I think that's so key when treating any mind body issue is the explanation behind it, like understanding,
Yeah,
brain, body, nervous system, how they are all interconnected, right? Like this
yeah,
is a separate
right.
thing that
Yeah,
we're kind of taught a lot of the time. Like this is how we understand chronic pain or symptoms just in general a lot of the time. And the research has come so
yeah,
far in just explaining
yeah,
that of what's
yeah,
actually taking place.
yeah, right, exactly. It's the evolutionary protective mechanism that we evolved, and that's what we have. And
Yeah.
it errs on the side of protection and then it gets the signals wrong sometimes,
Yeah.
for sure.
And so, leading into this, and we've kind of talked about this a little bit already, but what is the evidence that long COVID would be a mind body issue for someone? Like, if someone was like looking for like, what's the evidence? Like, what are you typically
Yeah.
looking for?
Yeah. Oh, that's a great question. And I will say that I do distinguish. I don't, and I wouldn't necessarily say that every single person on this planet who has long COVID, it's mind-body syndrome. I
Yeah.
think each person really we need to really investigate, just like you're saying specifically. I'm also not talking about people who were very severe, like in the ICU, that maybe did have some scarring in their organs, or, maybe they did have a little damage in their organs. So I'm not necessarily talking about that population. In my experience, that I think is very, very small. Like of the hundreds of patients that I've assessed, maybe one or two of them might fit in that category. And
Okay.
even those, some of the just of the ones that I've seen, of the hundreds that I've assessed, and really the rest of them, it really the pattern of their symptoms and the history of what their acute symptoms were and what they went through really makes sense that it's a nervous system problem. So I do think for the majority of long COVID patients, most likely it's this nervous system issue rather than damage in the body. But with that being said, number one, it is really important that someone is assessed by their doctor,
Yeah.
because long COVID is what we call a diagnosis of exclusion, which means we don't have a test to show that that's what is going on, like we have a test for diabetes.
Yeah.
We have to take all the other things that might be going on, do tests for those things, and make sure those tests are normal. So it is really important that someone see their doctor in this, in these assessments of patients that, were thought to have long COVID. There's a few patients, not a lot, but there's a few patients that have undiscovered diabetes or, a thyroid disorder or, something going on. Not very many, but some. And so it is really important that we make sure that's not that's not what's going on. But
Yeah.
it is fairly easy to do that. There are standard tests any doctor can do. We really don't have to go super deep into, strange tests, just the normal standard tests and making sure that you're assessed. Um, but then from there, how do you decide that someone has long COVID? So you make sure to rule out other things. But the other part is really looking at the pattern of the symptoms. And if the pattern of the symptoms does not follow some sort of structural damage in the body, like if the pain or the tingling or numbness or sensations, if they
Yeah.
don't follow a physiologic pathway of the known nerves, if they are on one side of the body and go to the other side of the body, or if they jump around, or they're worse sometimes and better other times in a
Yeah.
way that doesn't make sense physiologically, then that's a piece of evidence. The other thing is also having lots of different symptoms all over the body. The chance that there's some undiscovered reason for it because of damage in the body just gets less and less with the more symptoms that you have. Um, and, for instance, if someone, say, has damage to a nerve that's going down one side of their body, but then they have symptoms over here, and then they also have brain fog and insomnia and GI disorder and rashes and all these
Yeah.
things. Well, that one area, that's not going to explain all these different things. And so it's really stepping back and looking at the whole picture and
Yeah.
putting that all together.
Yeah. So it really is gathering evidence, just like we do with other symptoms in terms of mind body
Yeah.
connected.
Right.
You know,
Yeah, exactly.
I'm curious, what are often the, because I imagine there's resistance and doubt to this, of course, when you're dealing with people. I'm
Yeah.
interested in what are the stories people tell themselves of why their symptoms make sense physically, COVID wise. I don't know if there is common
No, there's a
thread,
yeah,
but
no, there's a lot. I mean, and I think that that is also propagated by some of the some of the studies that have been done on long COVID that are out there. And so micro blood clots or damage to the little tiny nerves or virus particles that are wedged in different organs. And I think that, or persistent viral infection or uncovering another viral infection like Epstein-Barr or something like that.
yeah,
So I think that, you know, those ideas really get stuck in people's brain, and then they start thinking about their body, and the symptoms they're experiencing in their body because of these ideas. So that there's maybe little micro blood clots all over their body that are creating these symptoms, or again, damage to the little tiny nerves throughout their body,
yeah,
or an imbalance of the hormones, the serotonin, or whatever it is.
yeah,
And so I think there's lots of different reasons. Or I think also the virus kind of getting wedged in different organs is a big one that people get that idea kind of stuck in their brain and focus on that. And I think that then when you have that idea that, oh my gosh, these viral particles could be stuck in my heart, I mean, that's so scary.
yeah,
And then the sensations that we're feeling in our body, we sort of then see experience through this lens of thinking of it as something scary like the virus particles stuck in there. Um, that can be a really scary experience to be living in your body that way.
Yeah. Yeah, and it's a really, as you were saying that, I was like, that is a scary narrative to be telling ourselves. And
Yeah.
the other thing, the other problems with some of those narratives is just the hopelessness and helplessness that probably I would imagine comes
Oh
with
gosh.
these beliefs.
Hmm. Yeah, right, right. I have a patient who's gotten a lot better, and she was telling me that on some of the groups, maybe Facebook groups, that at the beginning it was more people kind of sharing their stories and validation and trying to share what's out there. And she said that now at this point, people not knowing this, the people who don't know this model out is that it's really gotten to the point of desperation where she said that some people are even expressing suicidal ideas, which is just heartbreaking to
Yeah.
me. And I totally get it. I mean, if you have been suffering at this point, for 4 years with no end in sight, I mean, that's a dark place to be. Absolutely.
Yeah. And, you know, and then that is a very dark place. And I've seen the same for people with chronic pain or symptoms I work with, that it's just, it becomes,
Yeah.
and what happens is the more hopeless and helpless we get, more like our nervous system just gets this like shutdown freeze response.
Right.
And
Right. Right.
unfortunately, just spirals everything
Yeah.
out of
Yeah. Right.
control.
Exactly.
Yeah, because then you're in that state of survival, and
Yeah.
your
Yeah.
your body, the sensations you feel, like everything's gonna follow suit.
Yeah,
Um,
right, exactly.
yeah,
And I also just wanted to speak quickly too to these studies that are out there that show that one group, the long COVID patients have more of these changes, blood clots, serotonin changes, mitochondrial issues, like kind of all these different things. In that a lot of those changes, again, can be the biochemical response to the nervous system. Is that those some of those things can be going on, but it's not that there's this intrinsic damage in the body that the virus came and damaged our mitochondria, but it's again still the functioning of the nervous system that then the downstream is creating these changes. So when we go back, really the root cause and how to get better is looking at the nervous system. And again, if we really step back and look at the whole picture of what makes sense, is some people who have long COVID had an acute COVID infection, but some of them was really mild. And some people who have long COVID symptoms actually didn't have an acute COVID infection. They got it just after getting the vaccine. So, hours after the vaccine, and then persisted for months and years. So, if that's the case, then it couldn't be viral persistence. And some of my patients, even, they had the same symptoms prior to the pandemic that then worsened in the pandemic, but they were already present prior to the pandemic. So then that couldn't have been viral persistence of the particles. And also, even the studies that are showing some of these changes, not every patient with long COVID has these changes in their studies. And some of the explanations for that is, well, maybe it's that there's lots of different reasons for long COVID. But the more that we try to say, explain it by, well, it's a lot of different reasons. Again, that it just doesn't make as much scientific sense. But
yeah,
if we really step back and like look at the whole picture and put in all these pieces of the puzzle and say, how do all the pieces fit together? From my perspective, they all fit together great, actually, when we're looking at it through the lens of the brain and the nervous system rather than looking at it through the lens of the body.
yeah, yeah. And that was beautifully said. Just to understand, you know, that these changes can take place, and it doesn't necessarily mean that they're the leading cause of something being wrong in your body that's producing all these sensations.
Right, right. Hmm.
You know, me, one question I was wondering about, and I'd love your thoughts on, is, of course, the fear of COVID, I would imagine, would have been at a height, a high level during the pandemic. But I think for lots of people, and I'm speaking anecdotally here, so I'm not sure, but for lots of people, that fear is reduced over time. One thing I was wondering is like, and maybe we won't know this for 5 or 10 years. Like if there was a burst of people that are more likely to get long COVID right during that pandemic time and it's continuing on, or if people even now, like if long COVID is just such a part of our culture now worldwide that even when people, get sick, 7 years from now,
Right.
it's just becoming, do you get what I'm asking? Like,
Oh, totally. Yeah, like if there's a drop off in the number of people
yeah,
developing long COVID. Yeah, it's a great question, and I think that, and I don't know the specific answer to it, and it's kind of hard because there's so many people worldwide, but I do think that just in my experience, the people that I'm working with long COVID have had it for over a year or 2 years or 3, even 4 years, that there are fewer people, just in my experience, it's anecdotal, but
yeah,
are developing long COVID symptoms, although they're still there. But I do think it's less. And partly, I mean, a little bit of it also is back in 2020, the actual experience of having the acute COVID infection was way worse for many more people than it is now. I mean, for many people, it was a really scary experience. Like their oxygen level did go down. I mean, they couldn't breathe. I mean, it was a really severe infection. Whereas at this point, it's far more unlikely to have such a severe infection. So I do think that it's gone down some, but for ever really in humanity, there are these kind of chronic fatigue syndrome
sure.
kind of symptoms going on in different capacities. And I mean, I really look at it that everyone has mind body syndrome. Everyone on this planet has had something that's mind body syndrome. Whether it's a tension headache because you had a stressful day at work, or a stomach ache because you failed a test, or someone broke up with you, or whatever it is.
Yeah.
It's not necessarily for everybody that it becomes chronic and debilitating, but it's really just about how our nervous system functions.
Yeah. Yeah. And I agree with you there. Yeah, it's interesting how it kind of plays out. And you're right. Like throughout history, we have things that we label the reason for certain clusters of symptoms. And,
Yeah.
and I think that's the scary thing about long COVID is, if you're having brain fog or fatigue, or you start to develop these symptoms, maybe after you got sick, is now the new explanation that's being thrown out there of,
Yeah, right.
long COVID,
Yeah,
and
right.
it's being physically triggered. And so,
Yeah.
yeah, it's unfortunate because it perpetuates things forward for a lot of people.
Yeah,
Yeah.
right. Yeah. hmm
When we
Yeah,
talk
and I think,
about, oh, sorry, go ahead.
oh, no, go ahead.
I was just going to ask, when we talk about like how you work with patients with long COVID
Mm,
to get better, I'm
hmm
interested about what your framework or approach is
Yeah,
with people.
yeah, for sure. Yeah. So I think it's helpful to have a framework of kind of 3 steps. And the first step is understanding the science. And however you gather information that's helpful for you, it's watching videos, reading, having me tell you, whatever it is, but really understanding the science is key. And the step 2 is understanding the diagnosis, how it applies to you. So accepting that the reason you have symptoms is because of the nervous system rather than damage in the body. And
Yeah.
that's not easy, especially with long COVID, because there's so much information out there. People have so many different symptoms. So that's not easy, but it's really critical to have that second step. And it's also something that can evolve over time as you put in the pieces and gather evidence. And then the third step are the tools. And I think that's really important is that often people, maybe if they're on board somewhat, they'll go straight to the tools and they'll say, well, I'm not getting better because I'm meditating and breathing or something like that. But if they don't really understand the science and they're not really accepting the diagnosis, if they're like, well, I'm just going to try these tools, but yet I still am gonna work with my, other long COVID doctor who's giving me these medicines for my blood clots, and I'm still kind of holding on to this biomedical part of it, then it's really not going to work. And so it's really doing these different steps. And once you accept the diagnosis for yourself and you're moving on to the tools, it's really about thinking psychologically rather than physically, which is not easy. And when we have all these symptoms in our body, I mean, our brain evolved to connect up symptoms in our body with damage in our body. It's also how we spent our whole entire life believing and thinking, and also what our medical model believes and thinks. So it's not easy, but it's really important to switch that around. So then when we get there, it's really then figuring out what the tools are for a particular person that's going to help. And those tools are going to be different for everyone. But I sort of categorize the tools in different places. And I think one category of the tools are things that calm the nervous system sort of temporarily. And that's meditation and breathing, kind of all those stress management tools, restorative sleep, social connection. I mean, all those things are important, but those by themselves are not enough. And we do those, but then if the fear is still in the brain, the fear just goes straight back up. So then the other set of, but that's an important step, but then the other set of tools are really showing our unconscious brain that we're not actually in danger. Again, it's not easy, but those set of tools, again, are, different for everyone, but those are the sort of pain reprocessing therapy, or I call it neural reprocessing therapy because I use it for all the symptoms,
Yeah.
not just pain, but pushing into the discomfort a little bit so it's turned on, but couple it with safe signals and do it within within your capability. And then the other piece is our emotions and our emotional processing. And I think this often can be a really hard piece to understand how that would be a part of these physical symptoms or long COVID. But really understanding that the emotional center of our brain is located in our unconscious brain, and how that can all tie together.
Yeah. Yeah. And I like that layout because all of those pieces that you touched on, like I definitely try to utilize all of those with people. I
Hmm.
like to break down the strategies into the different sections. I think that's important for people to know, right? That it's
Yeah.
not like if you just do the meditation or breathing. Like I'm big on breath work and all sorts of yoga,
Yeah.
qigong, whatever you do to like relax. These are all important things,
Yeah.
but it's
Right.
not
Right.
enough. It's not enough.
Right.
Um,
Right.
I don't know.
Exactly.
Again, I'm going to jumble this because I read this study a while back. There was that mindfulness study. Do you know what I'm talking about? Where one group just did like the mindfulness aspect of the treatment, and then one group did the mindfulness plus the mind body education. And
Oh.
there was a huge discrepancy in how much people's symptoms reduced. Like,
Oh,
because
yeah.
the
Hmm.
education was so key. Without it,
Yeah.
like the amount of reduction in people's symptoms was very minimal. Like
Yeah.
there was some, but it was minimal. And so, like, I think that's an
Right.
important aspect that, like, the education and the acceptance of this is what's going on is so
Hmm.
vital because I liked what you said there, where people jump to the strategies as
Yeah.
this quick fix. I need to get rid of this,
Yeah.
but they
Right.
miss the learning and coming to
Yeah.
believe this is what's going on.
Right. 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 And a really important part of what you just said about that is that, yeah, you have to have the education, the science part of it, and mindfulness is helpful, but I think it's really key to understand it is not enough. And a lot of the kind of traditional tools, that goes into this work a little bit in chronic pain, that's sort of where it ends. And there's really these other tools that are really key. And one of those is understanding the body is not broken, it's the brain that's sending the signals. And it doesn't mean the body feels good, and it's not that it doesn't feel broken, and it's not that there's again, not these biochemical changes happening, but the root of it is from the signaling of the brain. But really the tools to get better are a lot deeper than just mindfulness and meditation and relaxing the nervous system. And what I find is so I love meditation. I learned meditation in college, transcendental meditation, and I think it's a great tool. I think it's fantastic. But I find a lot of people either they don't like meditation at all, which fine, that's okay. Then find other ways to calm your nervous system. You don't have to do meditation. But then other people that do meditation sometimes because they don't understand the other deeper tools are focusing on the meditation with such an intensity that they're doing it all the time, and then they're getting frustrated that it's not helping. And then sometimes even I find patients kind of get to the point where actually they don't like meditation. You know, they maybe started off being open to it or liking it, but even get to the point of not liking it, or maybe it's not helping because I think they're putting too much of an emphasis on it. So it can be a very helpful tool and part of it, but really understanding it's not enough. And we really need to do the other piece, often the emotional work, which is not for everybody. Not everybody needs to do it, but
Yeah.
I'd say a majority of people do, myself included. I mean, I'm a human. Um, and then again, sort of retraining the brain, kind of those pieces, how our personality traits connect up and put a lot of pressure on ourselves, how our trauma and our stressors from our childhood, how that connects up, really putting all those pieces in place, I think is really important and doable. I think it's very doable is
Yeah.
the key.
Yeah, no, I completely agree. And one thing I was thinking of as you were talking is, and I've even noticed myself fall into this in the past, is like all the nervous system regulation, like mindfulness, meditation, somatic practice, whatever it is. One thing that I see people, their downfall is they're almost trying to force themselves to just always be calm, right?
Yeah, right,
There's
right.
nothing wrong with calmness. I love calmness, but that's not how we're built.
Yeah,
We're not
yeah,
designed. We want to give people more of that ability to have that feeling in their body of calmness and safety. But I
yeah,
think, that's where, some of
yeah,
the work that needs to happen is you need to be able to approach uncomfortable things in your body, right? Like
yeah. Mm-hmm.
emotion,
Yeah,
trauma
right,
response, like these things,
right,
and you can do it
right.
gradually, but you're not going to force yourself to be calm all the time. So I like that you
Yeah,
broke down like there's these different
yeah.
areas of the strategies that you want to utilize as you're working.
Yeah, right. Yeah, I think that's a really important point is that I think it's a balance between we need to not turn around and run away from things that we're afraid of. We actually need to turn and face them in order to teach our brain that we don't actually really need to be afraid of these things. And whether that's, the symptoms in our bodies, so if it's movement or breathing or standing up because of dizziness and our heart rate going up or, all these different triggers, we actually need to face them to desensitize our brain and teach our brain that they're not actually dangerous. So if we're just trying to run away from them or calm our system, instead of facing them, that's not going to work. But then the other part is if we're just, trying to calm our system, like, we're studying for the SATs, or we're putting in our personality trait where we have high expectations, we're perfectionist, and then if we don't do it enough or correctly, then we beat ourselves up about it. So I think all those pieces come into play. One of the
Yeah.
big things that I talk to my patients about continually, I put at the top of the list, is find joy and do joyful activities. I think that's actually one of the most important things because if you're doing a joyful activity, it's sending messages to your brain that you're safe. And a big thing with that is that often the joyful activities that we experienced prior to, say, having long COVID, we can't do because of the symptoms in our body. And so I think sometimes people are like, well, I can't do joyful activities because I can't do those things anymore. Well, we have to find other things you can do. And if that's watching a funny movie or just hanging out with a friend or eating a chocolate bar or whatever it is finding that. And not that eating a chocolate bar every single day all day long, but starting small in a way that um, we can incorporate with our physical symptoms, I think is really important.
Yeah. And I think that's a thing that's missed a lot of times is the joy, like actually leaning into pleasant things. And that's hard. That's hard when we have chronic pain or symptoms
Oh yeah.
going on, but it's not impossible. And I think it's
Exactly.
one of these things that, is vital, because I've seen the opposite where, kind of like you're saying, where people are so enmeshed in doing the emotion trauma work and processing things, but they're not spending any time building a life that they actually want.
Yeah, right. It's finding joy and meaning.
Yeah,
Yeah, absolutely.
that's so vital. Well,
Yeah.
I really appreciate you coming on the channel and talking about this.
Yeah. Yeah, my pleasure.
There's you're a wealth of knowledge in terms of understanding some of this and explaining this to the world. So I really appreciate that.
Yeah.
One thing I want to ask is, if people want to work with you, if people want to contact you, like, what's the best way to go about doing that?
Yeah, my website is resilience-healthcare.com. And it's a great way you can contact me on there. And I have a long COVID virtual class that I run. And I'm really committed to really getting this information out there that there is a pathway to get better. And I welcome anyone contacting me. And, if someone wants to work with me, that's great. If not, I'm super happy to share the resources that are out there to get people better. Absolutely.
Amazing. Yeah. And for anyone listening, I'll put all that information into the description of the video so it's there. But thank you so much for allowing me to interview you. I really appreciate it.
Yeah, absolutely.
Yeah. And thank you.
Well, thank you.
Yeah. And thank you everyone for watching this as well. All right, take care.
Thanks a lot.